All right, we're live and all set to go.
Okay, good evening, everybody. This is the Board of Health meeting, Town of Northborough, February 8th, 2022. It's 6 p.m. I'm Glenn French. I'm going to call a roll call and then, I'm going to call the meeting to order and then call roll call. So I move that we open the meeting for February 8th, 2022. I would entertain a seconding of that.
Second it.
Okay. All those in favor? Let's go
Aye.
through it. Teresa and this. Let's go through the roll call, see who's here. How about that? We've got Delete Jane,
Present.
Teresa Capabianco,
Present.
Swati Sane. No,
Swati's not gonna be able to attend today.
okay, and Lisa Johnson.
Here.
Okay. I'm going to turn it over to Kristen Black, and she's going to let us know about Chapter 20 of the Acts of 2021.
Thank you, Mr. Chair. Good evening, everyone. So this meeting of the Northborough Board of Health is being conducted remotely, consistent with Governor Baker's executive order of June 16th, 2021, an act relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Northborough Board of Health are allowed and encouraged to participate remotely. The order allows the Northborough Board of Health to meet entirely remotely as long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the listed link on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. Just working through, so it seems like next step would be for roll call, but you've already covered that, so we're moving along. Thank you, Mr. Chair.
Very good. Okay, we're on the meeting agenda for the evening. We've got a COVID-19 update, including parts A, B, and C, which is case counts, contact tracing, and testing.
Okay. Thank you, Mr. Chair. I'm going to share my screen, so just bear with me a minute. Hopefully pull this up. You'll have to let me know. 1 minute. Are you all able to see that okay?
Yes.
Yes.
Okay, great. So, so again, we'll move through the agenda. Oh, actually, first on the agenda, Mr. Chair, did we want to go back to the posted agenda? Katie, did it include the approval meeting minutes?
Yes, the one that was posted with town clerk includes the approval of those 2 sets of meeting minutes.
Okay. Do we want to catch those later or now?
Yeah, let's catch them at the end.
Okay, so I'll just move right along. We'll just, Katie will be good to remind us so we can move on with those. Okay, so I just want to cover our case counts right now. Just sort of want to look at the big picture of where are we now, versus, our previous winter surges. And so this line graph or bar graph that's showing our daily case counts reported in Maven. So there's variability obviously with weekends, but we're looking at a full 2-year window here, so you can really see where we are relative to previous points in the pandemic, like that initial surge, in the spring of 2020. You can see, our greatest number of cases reported in a single day through Maven, which is the state's virtual epidemiological network, where we as the town of Northborough can see just our case counts coming through. So those are both probable and confirmed. That's antigen and PCR tests. None of these are showing at-home tests. So I just want to be really clear. So you can see back in the, March, April of 2020, we had a max of about 20 cases reported in a single day. Obviously the dip in the summer and back last winter, we were dealing with a surge then. Again, the number of cases reported, COVID-19 cases, really never crept above 30 during that surge. And then, let's fast forward along this timeline, which, is And we can see that, you know, our greatest surge is really about a month ago when we were holding a meeting and the board passed a mask mandate. And so we saw over 100 cases reported in a single day through Maven at the state. And we've surprised, you know, to my surprise, I've just absolutely seen those numbers really drop back down again through that most recent Omicron surge. So this next slide is just going to zoom in to really the last, you know, the most recent period that we're looking at here. So just over the 2021 to 2022. So it just zooms in on where have we been over the last year. And you can again see these numbers most recently, you know, in the last week or two, really coming down well below that, you know, 20 cases in a single day being reported. Just want to talk about this weekly dashboard. So in Northborough, we're fortunate that we did receive a grant from the Mass Department of Public Health. And as part of that grant, we did hire a part-time epidemiologist. So again, Isabella Caruso, you met at a previous meeting. She has her master's in public health, is working on her PhD in epidemiology at UMass, and she is producing this lovely weekly 2-page, very simple dashboard for our region. So again, this Greater Boroughs region includes Boylston, Northborough, Southborough, and Westborough. So I just did a small grab. I know it's tough to see on the screen. This dashboard is available on the town's website. If you click on the COVID page, it's right there on the COVID-19 homepage. It's pictured off to the right of the screen, and you see all those downward arrows. If you looked back 2 weeks ago, every hour was up, you know, and we're just seeing across all 4 communities plus our state averages, you know, that our numbers are down. So again, this report is released each Friday at noon. And if you'd like to see that in further detail, please go to the town's website. So to really hone in on our COVID-19 case counts right now, just as according to the last report from the state, our confirmed cases are 210, and this was the state's report released on 2/3, so February 3rd. Our 14-day average daily incidence rate, you know, is 110.6. Our 14-day percent positivity rate is 11.62. We are seeing less people going to the Stop the Spread sites. You know, the test numbers are way down because more people are relying on those home antigens. So there's a little bit of that. We don't have a lot of people aren't screening at these Stop the Spread sites. So we do have lower numbers, but that percent positivity is still quite a bit higher than we saw in previous years. So I just want to talk about what we're doing right now in town for our contact tracing and testing, you know, so the health department is continuing with contact tracing. If you have kids in the school, you might be following along, and the schools are sort of stepping away from contact tracing, moving towards a new testing program with free at-home antigen kits that are distributed. But in Northborough, we do still have nurses who are reaching out to our residents. These public health nurses are hired through the Greater Boroughs Partnership for Health and the Contact Grant Award, sorry for the typo there. And they're really focusing on making calls and providing support to residents under the age of 18, really focusing on daycares, families with young children, and also our residents over the age of 60. So those calls are still happening. At any point, if residents have questions, because again, a lot of people are just relying on at-home tests, they can call the Northborough Health Department at 508-393-5009. And during regular business hours, you know, a nurse will return your call within 24 hours. So we're here to answer those questions. Just want to reiterate that free PCR testing is still available at the Stop the Spread sites. Worcester, Marlborough, Ashland, and Framingham are our closest sites. More information on those testing options are tinyurl.com/mborough testing. And again, residents are encouraged to seek testing if symptomatic or exposed to someone with COVID-19. And hopefully everybody went online to the federal website to request their free, you know, 4 tests per household. And those are starting to arrive in the mail now. And so I'm going to stop the screen share there. I don't know if you have questions about our recent case numbers. I did email the board some updated counts over the 14-day period, because again, that 2/3 report from the state was a little bit older, and we are seeing a drop. So I just want to read through quickly those numbers. You know, at the peak again for our 14-day window of tests, it was reported on January 14th, you know, a week after, I guess, or so, the mask mandate was put in place. We had 645 cases reported in Maven during that 2-week period. And then again, running that number again just today, the last 14 days, we have about 83 cases. So going from 645 on 114 till today on 2/8 and seeing those cases drop to 83 within the last 14 days. So I don't know if the board has questions for me about case counts or testing or contact tracing.
Is there a, if we compare ourselves to the other 3 communities that we're partnered with, do we have the highest positivity rate? I know you said that 11%, 11 point whatever percent. I mean, I still think it's above 10. That's still quite high. That again, that was a week ago. But how does that compare to the other communities?
I'm pulling up the dashboard right now.
Okay.
And I'm clicking. So our percent positivity in our surrounding community, Westboro was 12.61 in last week's report. So the state pushes the percent positivity out only once a week,
Okay.
so
Yeah.
a lot is changing. Southborough was reporting 6.81% positivity. So quite a bit lower, and Boylston was reporting 10.48% positivity.
Okay.
It seems to follow right with the population of the town.
Which is
Like, I
surprising
know it's
because
all-
it's
it's not
a
relative, but-
percent. Yeah, it's surprising, but
It just seems like, Westboro has the most
yeah.
people, and that's the highest percent, and it just seems to go right in line.
Yeah.
I don't know why, just everybody's crowded. I don't know.
Yeah. We are seeing a steady decline, the last few
Yeah.
weeks on that percent positivity.
And the schools, how are they doing? Do we know?
They're also seeing very similar trends. I mean, the schools are receiving reports from families with at-home kits that we wouldn't necessarily, have those positive results in our
Right.
system. But, I was just on a call with the medical advisory team. We're looking into the school discussion right now is around DESE. The Department of Early and Secondary Education is likely not to renew their mask mandate on February 28th. So there's a lot of talk about, lifting of mask mandates in the schools. But again, I just want to remind, there's layers here. So the Board of Health passed a mask mandate that was universal across all indoor public places. But still, even before then, public businesses had their own mandates. Town Hall, for example, has its own mask requirement that was in play before that, and some businesses have been more restrictive. So as a private business, there's been differences there.
Kristen, do you know what the vaccine rate is in our young population in the schools?
Yeah, so we have very detailed, vaccination rates by schools. The individual, every school has a tracking system with Mary Ellen Duggan, our wellness coordinator. So our high school vaccination rates are very good. They're well over that 80% number they were looking for. Melican, which is our large middle school, that right now is around 78% vaccination rate. I believe that's fully vaccinated, and then it sort of goes down from there. I'll see if I can share, or I can at least pull up the numbers. I did look in town at the most recent vaccination report that's produced by the state. So this was put out as well on February 3rd. We have one of the highest booster rates. I think we're like 15th in the state of Massachusetts for our boosters. Our high school had really good rates, are 16 to 19%. Individuals with boosters in that age category. So really our high schoolers, was 71%, had received a booster. Overall, when you look from the state's report, Northborough, again, we're one of the highest vaccinated community, had the highest rates of vaccination. They're showing for eligible population over 95%. That's
Wow.
probably not totally accurate because it's based off of older census data. So we have more people in town, so it's definitely skewed. I don't think we're necessarily over 95, but it is still very high. And the younger age categories, it is a bit lower on those vaccination rates in the younger children. We have a lot of vaccine hesitancy with families in that 5 to 11-year-old age. And I could give you those numbers if you just bear with me a minute. Let's see. So again, considering that February third report in Northborough for fully vaccinated, not talking about boosters. Our 5 to 11-year-olds fully vaccinated per capita, though, in Northborough is 77%, according to the state's report. So the schools are going to report a little lower than that, just again, because this report from the state is based off of old census data where they're going, line by line, individual by individual. And overall, all of our categories are over 95% vaccinated, fully vaccinated, with the exception, for some reason, our 75-year-olds are 92% vaccinated. So again, really high rates for Northborough.
Excellent. Good. Any further comments, statements, questions from the board?
Glenn, I actually have a question that doesn't have anything to do with case counts, but it has to do with the test kits that are being sent out by the federal government. And I know that there was some concern about the efficacy of those test kits in certain locations, such as here, because of the cold weather. Is that something that really is a concern, or is that more of the COVID hysteria that tends to come out sometimes?
This was covered, just today. They were discussing this on the call, and I could try to pull the notes up from that meeting, Teresa, and get you more formal response. Any of the test kits, like the ones we receive from the state, the antigen test kits, there are recommending holding temperatures for those, the sensitivity of the strips. But it does seem, I do want to preface that antigen kits, that those are the free at-home ones, aren't as good at detecting infection early on, like on the first few days of symptoms.
Right.
So it's definitely a phenomenal tool in the toolbox. But if you have a known exposure and you're symptomatic, and you have a negative
PCR.
test, it's definitely something that requires follow-up. And we're fortunate that those PCR test kits, free PCR testing is available. Let's think of the New England Sports Center site is very close, 8 to 12 every day they're open, people can get through. So I'll continue to, I'll follow up on that, Teresa, with the state's response to that exact question. There is, some concern overall, but it's a very short time with those cold temperature exposures. They're shipping them out very quickly. But there is a bit of, recommending that, consecutive tests, especially if you're symptomatic. And then if you do have a known exposure, you don't want to go out and take that test right away. It's not going to tell you anything on day 2 after exposure. You really want to aim for that day 5 after exposure and take precautions as needed.
Yep. Okay. All right. Thanks, Kristen.
You're welcome.
So Teresa, is that saying if the test has been exposed to cold weather, the word is that it's no good?
Yeah.
Or is it if you're out in your car and you're taking the test?
No,
is no
it's
good?
well, I mean, for somebody like me who gets the mail like every other day, it's
Yeah.
now sitting in my mailbox in whatever the temperature is, whether it's below 0 or 20 degrees for 48 hours, which I think, my understanding is it could affect the efficacy of that test, even if administered properly 5 days after your exposure, because it's been exposed to freezing temperatures.
Oh. For 48 hours or 20 minutes? Does that make a difference?
That I don't know.
I don't know.
Don't know.
That I don't
Okay.
know.
I guess if you don't feel well, you go down the ice skating rink, the international, or the what's that called, Kristen?
New England Sports Center.
Sports Center, I think, yeah. Thank you.
So easy now.
It
The
is
big
very
long
easy.
lines of yesteryear are gone, and
That was right around the holidays that they had the long lines with people coming and visiting, and they wanted to get checked before exposing grandma
Yeah.
and grandpa to that. Now you can pretty much get in there, and within 5 minutes you're out of there. So it's
Yeah.
very easy. If you're symptomatic, you should get a PCR test done. You don't,
sure.
the home antigen test is unreliable. Those ones you buy at the store at CVS are the same thing. They're pretty much the same. If you just want to check because you thought you got exposed, wait your 5 days, check it. If you have 0
Yeah.
symptoms, that's fine.
All righty. Well, if that's it, I think maybe we go on to the review of the town-wide mask mandate. COVID-19 public health emergency regulation, which has been in place since January 6th. And should be looked at again. Question being, do we continue? Do we limit it? Or do we end it? at this point. With that in mind, the school mandate closes February 28th, terminates February 28th.
Well, that, yeah, I believe Desi should provide an update, in the next week or so. But there is some discussion, it is due to expire, I believe. It's
Yeah.
February 28th, so that's coming. And then we're waiting to see what the schools will do. And individual districts, again, will have their own ability to require local mandates, just like businesses or can do the same. So I think it's, the schools are meeting with their advisory groups and their policy subcommittees on the mask mandates with the different districts and their school committees to make decisions on mask requirements in Northborough schools.
So regardless what this board does, the school mandate stays until at least the end of February.
I believe so.
A lot of towns and cities are dropping the mask mandate, including Worcester. It shows up on the news, so I don't know if that's a good thing or a bad thing, but it seems to be the movement of the day. I know when we passed it, things were really out of control. I think things are going in the right direction. And my position, and make my position known, is I think at this time we could suspend the mask mandate in the town of Northborough. But I'm more than eager to hear Dr. James and James and Lisa's position, as well as Teresa's might have changed. So welcome comments from the rest of the board.
I'll go first.
Okay,
I'm going to take a real logical approach to this, and that's how I function. The rates have come down. We have a high rate of vaccination in booster vax in town, which is phenomenal. Thank you, Kristen, and Kate, and for everybody involved with that. You've done a great job. It's reasonable, I think, to rescind the mandate. However, the Board of Health and the Northborough Local Board of Public Health, the agency, we really should be clear that we continue to recommend vaccination, wearing a mask in public, and social distancing. Those recommendations don't change. And I don't know to what we have not been able to measure how well this mask mandate has made an impact on the numbers. I'm sure it's helped. I would like to believe it has, because more people are wearing masks and it's going to reduce the spread to some degree, but we can't quantify that. But we can look at the numbers, and they're quantified, and our vax rates are so high. So if we align what we're doing with the Mass Department of Public Health and federal CDC recommendations, I think it's reasonable to rescind the mandate. We all have our personal points of view on this, but I think I'm not putting my own personal view on this. I will continue to wear a mask until it's no longer recommended by the experts, but I think people need to feel that they have some autonomy with this. So that's my position.
is the city of Marlborough still under a mask mandate, or have they lifted that?
That was lifted, I believe, yesterday, and I did email a link, right, soon before the meeting. They did convert it, sort of your point, Lisa, to an advisory. So rather than to not comment
Right.
at all, we did not have an advisory, I don't believe, in, the state has an advisory. I don't believe the Board of Health, we ever voted an advisory. So if you want to check your email or go on Marlborough's site, they did do a very succinct, few lines advisory as they rescinded. But that was just done, I believe, yesterday.
I tell you, I was in the grocery store at Hannaford's earlier today, and almost every single person was wearing a mask, which is a good sign, including myself. Delete.
Yeah, so I mean, to Lisa's point, I think, the numbers have dropped significantly. Some of the surrounding towns have started to rescind, but not completely. So public transportation is still required to wear a mask, even in Worcester. So there are some subtle exceptions to the rule there, which makes it a little difficult, right? When you're out and about and all of a sudden you have to get into
Right.
a place like that, then, when do you decide it's not? So as far as mandating the mask, yeah, I mean, I think we can look at possibly rescinding that, but I think the board should continue to recommend or strongly encourage people to wear the mask, when indoors. If you're outside, I think it's a little bit less of an issue. My only concern is, of course, we've got 3 different entities in the town of Northborough that have different rules and follow different sets of rules. And that's that's concerning, right? We control what the town is doing. The town hall has their own set of rules, which doesn't follow what the board recommends. And the schools follow their set of rules that's set by the school board. So, I mean, you think about it, if you're going to all 3 different places, how do you
Yeah.
keep everything together? Is this something because the schools are going to rescind the mask mandate on February 28th? Is that something we should follow? Again, I'm not saying one way or the other. And what's the town hall going to do? Are they going to continue wearing the mask till
Forever.
infinity? I don't know. Okay. And I think that's what we have to look at, right? Because you have 3 different quote unquote institutions in town. And you think about all the schools, and I suspect the private schools are in the same boat as the public schools, right? I would think that they follow those rules. But there's 3 different sets of rules, and you can imagine people going from one to the other to the other. What are they going to do? I think we want to be clear so that people don't get confused about that. And that's it. I mean, I think the numbers being down as quickly as they have come down, I think it's not a bad thing to consider doing that, but to continue strongly encourage people to wear the mask, when they do go into public places, but not make it a mandatory thing.
Yeah. Teresa?
As you could probably surmise, I'm in favor of rescinding the mask mandate. I don't take issue with an advisory coming out from the board. I think at the end of the day, everybody needs to take care of themselves in the best way possible that they see most appropriate. And if that's wearing a mask, that's fine. I don't see any problem with encouraging it. But again, releasing it as a mandate, I think is probably appropriate. So.
And
Mr. Chair, so I just wanted to comment, we did, Katie.
I was
thank
just
you,
going to turn to
Angie.
you,
I
Kristen.
know,
So-
in the office, we've been receiving a lot of calls in the last week. And I think it's just, communities are hearing that other towns are lifting, that, and people are following the numbers. I know we've had good feedback on the dashboard and they're seeing all those downward arrows on page 1. And so when we first passed the mask mandate just a month ago, we were sort of expecting a bit of a backlash, but, we probably received more calls from members of the community thanking us and, than we did for, the few calls where we had where people had concerns or felt that, it was over the top or however you want to word it, that we shouldn't be, requiring that for residents. So, but in the last week, I just want to express that, I haven't received any calls or emails asking for the board to keep it in place. But I've received probably 10 plus stating that numbers are down, you should be rescinding this, even from an individual who was worked at a hospital in the medical field and,
Yeah.
people expressing concerns for, children, social, emotional, anyway, you've heard them all. But I just want to say we have received many comments from the public, about 10 or so, which for a Board of Health is a lot. We don't get a lot of comments, but they've been one directional, right? About the board rescinding, given the drop in numbers. And I think everyone was respectful and they're following the numbers and just wanted to relay that to you.
Well, I think it did 2 things. Hopefully it did what the mask is supposed to do and prevented some people from transmitting and getting sick. And also it brings the awareness to everybody to keep your distance, wash your hands, try not to breathe on people, and if you're uncomfortable, wear a mask. And it doesn't ostracize anybody running around wearing their mask. I think it did its what it was designed to do. And
Hmm.
we're probably ready to take a vote to see if we should rescind the mask mandate at this point, unless anyone's got anything else to say.
I would make a move to remove the mandate to rescind.
I would second that motion. And then we'll go through the roll call. Delete Jane,
Agree.
agree to rescind.
Yes.
Teresa Capabianco,
Absolutely agree.
Lisa Johnson,
Agree.
and Glenn French. I agree as well. So it's unanimous. The mask mandate is now rescinded with the advisory.
Do we want to
language
work
for-
on the language? So if it's going to, I guess, will we do a separate motion if you did want to issue an advisory and to specify the language of that advisory? Because you
we have
mentioned
to
I would say the rescind is one step. If the board did want to do an advisory, I would recommend a separate motion, and I'm not sure of the language.
What is an advisory going to do, like physically? Where do you write it down on the front of the door? Like
Yeah, well,
another notice?
I mean, there is a statewide advisory, right? The
Right.
state of Massachusetts does have their, mask up their whole campaign and a state advisory. I think in the past, that's why the Board of Health is not necessarily, we didn't go to the step of an advisory because there was already one in place. But I think that would be a separate motion if that's something you
Okay.
wanted to do tonight, or we could delay that to a future
No,
meeting.
I think we should take care of business. And I would ask Lisa to present the second motion because she worded it perfectly earlier on.
Are you asking for my opinion?
No, I'm asking you to make a motion.
make a mo-
to-
I am
Or
hesitant
maybe you don't
for
want.
an advisory. I think as long, and please, Kristen, you could enlighten me a little bit on this. I don't know what the gain is for Northborough to create an advisory if we're aligning with what the state is already recommending. I think that would just be the, staying in step with what the recommendations are. If it into, the point made, what is the gain? And we would need to revisit that. I don't mind revisiting that. It's not that it's difficult to do, but is there already language out there saying that the Board of Health, the local Board of Health, the town of Northborough, encourages you to follow the guidelines, vaccinate, wear a mask in public, social distance? Is that language not out there, and we would need an advisory to really be encouraging that message?
It could get, like Dr. Jane was saying, Dilip was saying, it could get kind of confusing to the citizenry of Northborough as to whether, an advisory, am I supposed to be wearing my mask or not wearing my mask? Whereas, again, that's what I was getting at. Lisa was like, well, what is an advisory? Is it written on our website? I don't have a problem with it.
I would think it would be on our website anyway, because we as the
yeah.
Board of Health can recommend that, but do we need the term advisory? What is that a legal term that brings some power with it, or some benefit?
In the past, just, prior to the mask mandate, on the town's COVID page, I had a link that just said mask advisory. And that link on the town's COVID page went straight to the state of
The state.
Massachusetts advisory. And so, to your point, Lisa, things may change, so, if there is Omicron, then there's Delta, now you need it on public transport, or you don't need it on public, so those rules are constantly changing. And so I think in the past, it was a static, it was just directing our residents to the state's most current mask advisory. I'm on the state's website. I believe it's like mask.gov or, but you can just Google mask.gov, mask requirements. And so it does, break it down into vaccinated, unvaccinated, right? Because there's a lot of nuances there. There was effective, there was an update December 21st, 2021, in response to the spread of Delta and emergent Omicron variant. Department of Public Health now advises all residents, regardless of vaccination status, wear a mask or face covering when indoors and not in your own home. The DPH particularly urges this recommendation if you have a weakened immune system, or if you're in increased risk of severe illness because of your age or underlying medical condition, or if someone in your household has a weakened immune system, is at increased risk of severe disease, or is unvaccinated. So there are, details to the state's advisory. It was last updated, I believe, May 29th, prior to the December update. So, I think if the downside of an advisory is you need to stay current. And to, Dr. Jane's point, it can be a little confusing. So I would say at a minimum, what we would do, if there was no advisory voted by the Board of Health, tonight, and it might take more time if we really wanted to go that direction, or go as simple as Marlboro's few sentences of recommendation, but I would definitely link to the state's mask advisory, which I think is a little more detailed, but in line with CDC as well.
I mean, so could we do that? Could we put a thing on the website saying, while we are rescinding the mask mandate, the Board of Health, the town continues to recommend people follow the Commonwealth of Massachusetts advisory regarding, COVID,
Mask and here's
COVID
the,
prevention, whatever it is, including vaccination, wearing a mask while indoors, we could just put it that way, right? So that way, and then put a link that people can click on to access the Commonwealth's advisory. And then as that gets updated, that'll get updated too automatically. Agreed. That's not been done for 8-9 months, but
yeah.
that
There's
may be the
alignment
simplest
there.
thing. That could be the simplest way to deal with the advisory. So we don't have to do it.
Mhm.
We just say, recommend continuing following the advisory as put out by the Commonwealth of Massachusetts. And here's the link to that.
On our website.
Yeah, on our website, and put a link to that there.
I think that's perfect. Do we need to move to do that? Do we need a motion to do that?
Kristen says we do, but I don't really know if we do.
Well, if it's not an advisory per se,
Right, it's just a recommendation
Yeah,
of
just a
follow the
recommendation.
state's guidelines.
Yeah, that's it.
I can make sure
That's-
to put that on the website. So I guess the language will say that while at, tonight's meeting, the Board of Health voted to rescind their mask mandate. They are recommending for you to, for residents to follow. I should just say residents, employees, visitors, we normally try to catch everything in Northborough. To say that, you would follow the Department of Public Health mask mandate. And I would say continue to encourage vaccination and other prevention strategies to slow or limit the spread of COVID-19. Does that work?
Maybe instead of saying the word mask mandates, because I
Yes,
think that has a
mandate's
different
gonna throw everybody
mask
off.
mask requirements or
Mask
mask
Recommendations.
recommendations. You know what I'm saying, as opposed to mandates. Mandates has a totally different connotation now after this 2
Yeah,
years.
It's gonna go right back to the same.
Yep.
Conflicting verbiage.
Okay.
I like that. That's great. I think that's fair. I think that's logical for where we're at right now. That would be very helpful.
Right? So we're all set on that now?
The only
Kristen?
question, actually, we should have clarified with the vote. We didn't say when. We just rescinded. I'm assuming it's
Oh,
immediate
yeah.
because,
Immediate.
otherwise we'd have to rescind. The vote wasn't clarified. So anyways, I don't know. We have two lawyers here. Help us out.
All right, well, today's over, starting tomorrow, tonight at 12 a.m. This morning, this coming
12 a.m. tomorrow morning.
Mhm.
Wednesday, 12 a.m. 12:01. February 10th. February 9th.
9th.
February 9th.
Yeah.
Works for me. Now, is that an amended motion?
It's
Or we
just,
just
I was looking at
clarified?
Robert's rules here. So it looks like Given that there's already action taken on it, I don't know if we can rescind it to action that cannot be reversed. 2/3 vote of those present for a majority of the vote. I don't
Why
know.
don't we make another motion that the rescinding of the mask mandate
Yeah.
shall be effective Wednesday, February 9th at 12:01 a.m.
Second,
Good. All those in favor? Delete,
I,
Lisa,
Yes,
Teresa,
still absolutely yes.
and Glenn. I as well. That motion's passed as well. Excellent. Let's hope it's, we never have to revisit it.
yes, agreed.
Agreed. Okay, how about grant awards? This is interesting. Kristen,
I can go to that. Do you want to go back to 4 for appointment of medical director, agenda item 4?
oh, I'm sorry, I missed it.
Oh, no.
3, appointment of medical director for the town's vaccine program through Massachusetts Department of Public Health Immunization Division.
So we obviously run immunizations through the Northborough Board of Health. And so there were just, we didn't have I had to do the renewal last week, and there's a question of, have we ever formally appointed a medical director? So obviously we have medical doctors and they can sign standing orders. We also overlapped our immunization program with COVID with our town's fire department. And so our fire department has a contract with UMass, to sign standing orders and oversee the activities that they do on the medical end. But with the Board of Health, we don't have a formal appointment. And so we have Dr. Jane, we have Dr. Sane, and then sometimes we've used Dr. Tennyson, Joseph Tennyson, is who's been listed with the fire department. That's their medical director. So my hope tonight was to sort of just clean that up and be clear as to what doctor we want to officially have listed on our immunization program. And that we would do a formal vote, because we've never documented that. So in my prior community, there was a medical director that was listed on the Board of Health's website. But this could just be specific to the immunization program. So I know Dr. Sane isn't on tonight, but I did inquire with her about her interest, and I'll let Dr. Jane speak for himself. Dr. Sane, she had some concerns about insurance. She, with the company she works for, they had inquired, how would this work, et cetera. I do want to state, I did reach out to Dr. Tennyson, because he has been listed on some of our clinics, especially when we're working in close partnership with the fire department. Dr. Tennyson is an MD. He also is on the Marlborough Board of Health. I think he's their vice chair, formerly their chair. And he did say that he would be willing to serve as our medical director in this voluntary role in the event that there weren't any members that would be interested, medical doctors in serving that role. But I'll turn it over to Dr. Jane. I just didn't want you to think we're in a tough predicament, but to speak for himself about, this position or this role.
Right. So I think the insurance thing comes into play here. Whether I know the town, we get covered by the public officials liability policy. Is that enough to cover me, barring any incidents, for any decisions that we make regarding the immunization? Or do I have to have a malpractice coverage since I'm no longer practicing? Obviously, I'm not required to carry malpractice coverage anymore. So that's my question that I sent to Kristen in the email, is like, if the town says, no, that'll cover me as I'm acting as an official on behalf of the town at that time, I'm ready to serve as that. If it doesn't, or if we can't get a clear answer on that, then, I know Dr. Tennyson, I know Joe. He's an ER doctor at Marlborough Hospital. So I know him, I know who he is. Either way, it's fine. Would there be a conflict for him to be serving on 2 boards of health at the same time, or representing 2 boards? That's the only other question I have.
Right.
Would there be some conflict there? Because he is on the Board of Health in Marlborough. And then he would be serving here, and I don't know if there's an issue with that.
Mhm. I would say regarding that, you know, he wouldn't be a voting member. It would just be listed as, you know, be serving as our medical director
Fair
only.
enough. Fair
Under
enough.
the immunization program, still Dr. Sani is listed, and she's as the ordering provider for our testing that we're doing in the building. So that's already separate. So I won't, you know, we're only inquiring because the state has a very formal process for documenting the medical director under the immunization program. With the town insurance and the volunteer, like the liability coverage, I think it's just that, like, the town is covered, but like malpractice or, you know, I don't know how far that would go. And I think only a lawyer could probably give you that answer. And the response I had back from the town administrator's office was just as simple as the one I had forwarded to you,
Right,
Dr. Jane,
right,
which is
right.
just, so I would say regarding malpractice, you know, it's not really there. So could there be a risk, you know, with you not having that on your own? You know, I don't want to speak to that.
I think we better table that. I don't know, have town council look at it, or get some more definitive information on it.
But I mean, to make it clear, Glenn, I'm not saying I want to be. I'm more than happy to serve in that role.
Yeah,
But if it's too much of a hassle to get that question answered clearly and succinctly, then by all means ask Dr. Tennyson to do it. I'm not averse to him
Right.
doing it. So to make
Right,
Kristen's
right.
job a little easier, if if that'll help, I'm okay. I'm all for that.
well, maybe we could just look into whether it's a conflict. If he's already said he's, if
He's a
Dr.
medical director of
Joe-
the fire.
has already
Yeah, he's
said
already
he's
medical director in fire.
He's already
It's
medical
some-
director for the fire.
Right. In some ways early on, I would say there would be an advantage to that because we're working in concert, so
With the
a
fire.
lot of our vaccinators are really his,
Yeah.
fire department staff, that are already familiar with him. So I think there's advantage, but we also work with Salmon VNA. Salmon VNA has their own medical director, they're under, so it's already a little all over. It's all kosher, but that's just something to think about. So there's some advantages to consistency. I know Dr. Stennis is available, but so is Dr. Jane. So I think I would, Dr. Jane, leave it to you because we can, this vote doesn't necessarily need to happen tonight. So we could,
Oh, okay. Then
we could
I would.
continue this discussion till next meeting and we'll look for clarification from council if you prefer as well. So
So-
no rush on my end. I just needed to get it
Okay.
out there before.
No,
Give him
I
a
would be interested
Okay,
if that gets clarified.
okay,
So if that makes it clear, then yes.
perfect.
Yeah.
So I don't think there's a vote that needs to take place. We'll just, it's not opening a hearing or anything. So we'll just continue and Katie
Fair
will keep that as an agenda item for next meeting and look to get clarification. So perfect. Thank you.
All right, now we can get to grant awards. Got two items, Metro West Health Foundation Municipal Public Health COVID-19 Response and Mass DEP Air Sensor Grant. So what are these two items all about, Kristen?
Yeah. So these are both two new grants. I don't think you've necessarily heard of. So the Metro West Health Foundation does issue grants to municipalities. So in our greater boroughs region, both Southborough and Westborough fall in their jurisdiction. Boylston is not part of that. So all three of our communities, Westborough, Northborough, Southborough, we applied for the full grant amount with the COVID-19 response grant. This was new. This was offered to all communities in their region. And the max amount was $50,000. And it's really for specific to COVID-19 response. So we wrote the grant and we were all doing it sort of in concert, that the three communities are really looking to offer the same services to their residents. So we're looking to purchase additional at-home test kits, looking to purchase disposable masks, KN95, and other educational items to distribute to our residents. It's, we want to target this program towards our food banks, community meals, Meals on Wheels, having additional test kits available at our schools for our low income or families in need. And so it's a great resource. It was awarded. The check should arrive next week. And I also wrote in for a $5,000 outreach coordinator. because it's great to buy all this stuff, but who is here to get it all out the door and order it and drop it off where it needs to go? So we've identified an individual to serve in that capacity. It would just be about 14 hours a week, and it's not formally done yet until we have the check in hand, but we'll be looking to increase our outreach, to some vulnerable populations. We also can provide educational and translated information on vaccines and local vaccination clinics, et cetera. So it's a great outreach program, and it might be a little too late. Who knows what the mask needs will be or testing needs by the time the kits come in. But we're also looking to purchase kits as a region off the state's bid list, the iHealth kits, the same ones you might have received through the federal government, with the mailing or through the schools. Those iHealth kits are cheapest if purchased as a pallet, which 2 per kit, and it's I think like 7,560 of them. So we're all sort of pooling this. It's like a $75,000 purchase for this amount of kits. And we're preparing town hall to be able to store those and make those available to residents. So the program is really aimed at making them available at, sort of those targeted populations where there might be the most need. So that's how we're hoping to use that grant. I'm really excited to make these items available to our local food banks and senior centers, and we could also make them available at churches, et cetera. So if you know anybody in need, those items aren't here yet, but I'd like to think we'll have those packages up and ready to go probably in about a month's time, and continuously available. Those kits do expire in 6 months, so it's not that we could stockpile them and keep them for next fall. Those would expire sometime in probably early August. So we'll keep an eye on it, but we're very excited to be able to offer to our community.
Good.
I put my money
Good
into
news.
masks.
Well, masks will last a lot longer. So I think what we're looking to do with the budget is we also have unspent funds from our Greater Boroughs Partnership for Health and the contact tracing grant that we did receive approval to use about $20,000, and that was going to be unused due to the delayed start or hiring. And so all of it, I think we were thinking about 22,000 of the 50,000 would go towards those test kits, and the remainder could be used for other items that we would need.
Does anyone have any comments? The $50,000, that's 3 towns?
Sorry about that. So the 50,000 is for each individual town.
Oh,
So I have a tickle, so sorry. It's so fun to cough during COVID. So it's 50,000 for each of the 3 communities.
Oh, that's huge.
A lot of money.
huge.
Yes, it is.
All right. Anybody else? What about this air sensor grant?
So
Mass
this is-
DEP air sensor grant.
Yeah, so you may have read about this in the Community Advocate. They did a nice job covering that. An article on this. This is a new Mass DEP initiative to monitor air quality across Massachusetts. This is outdoor air quality, so not a lot of people read in the paper that it might be located on the buildings or schools, and what is this going to mean? What's wrong with our schools' air quality? Nothing like that. This is about monitoring outdoor air quality. And these purple air sensor grants, air sensor receivers will actually be uploaded straight to the state. And the state has a detailed ArcGIS database, so you'll be able to see our air quality as it compares to other communities across Massachusetts. So it's a really nice opportunity. Southborough is also doing the same. So we're working closely. Our schools have been phenomenal, and we're really excited to be able to deploy in about a month or so.
So how many of those sensors does the town get?
Just 5. Yep.
So just 5.
sensors.
So we can basically put them across the town wherever we want to measure the air quality. Is that what the goal is?
Correct. It will be on all of our schools because we need a municipal building was ideal, access to Wi-Fi and those sort of things.
Oh, okay. So it has to have certain criteria where it should be placed then.
Correct.
Okay.
So I did just want to be clear. It wasn't in response to any air quality issues. It's more just a
Okay.
public health issue of monitoring outdoor air quality across Massachusetts.
was the first thing that came to mind.
Yeah, I know.
And you've got the spots all picked out. It's the high school, middle school, and 3 elementary schools.
Correct. Now, which 3? Because I believe we do have like
We have 4.
or 6
We have
schools.
4.
I'm sort of leaving that to the schools because I think, the hardest thing is the installation. Where do you locate it on the building? And it shouldn't be in direct sunlight. So I'm sort of said to the schools,
Well, I
they're
mean,
gonna be working on that plan. So
Melican and Lincoln are right next to each other, so you might
Right,
be able
so
to
it
get
might
away
make
with
sense.
one,
Right.
there. So it could be Proctor, Peasley, and Z.
Mhm. Good point.
And that's all monitored through DEP. It's got nothing really to do with us.
Right. There will be an element of a small educational component in working with the schools and possibly Mass DEP staff and coordinating with Dr. Alker, the health director over in Southborough. So hopefully as the data comes in, it will be a fun project for environmental science class or some other course where you can build it into the curriculum where they can look at the local data on air quality and try to do some comparisons across the state or maybe even looking at other countries just as a educational tool. So that's a
Interesting.
requirement of the
Sounds
grant
good.
we'll be working on.
Sounds good too. A lot of work going down. A lot of work going on over there at the town hall. Very nice. I appreciate it. Thank you very much.
Yes, specifically the Board of Health.
Craziness. Okay. If anyone has any further comments on the grants? Nope. All silent. We have to go through at least approving or go through the minutes. So we've got minutes from December 14th, 2021. Does anyone have anything to add, subtract, correct on the December 14th, 2021 minutes?
Yeah, I think we're missing the word TO. From the reorganization of the board to discuss. I think there's, it's not opening the link, but I think it was a 7/29 time frame where the reorganization of the board. I think the word "to" is missing. Correct, Katie? All right, thank you.
Yes, I see what you mean. Thank you.
Yeah, at
That's
work.
Elite is a good reader.
Well, I'm a grammar police even at work, right? When we're reviewing documents, they say, Dilip, okay, what do you think? What do you see here? I say, okay, so I'm the
Excellent.
grammar police.
Very good. Anything else, December 14th?
Nope. I'm good with
Nope.
the rest of it.
Okay, Teresa?
I don't have any changes. Thank you.
Okay, and Lisa?
It looks good.
Okay, so then I'm gonna move that we approve the minutes from December 14th, 2021 as recorded, but for the word TO, which will be added into reorganization of the board paragraph.
Second it.
Okay, all those in favor?
Aye.
Okay, let's delete
I.
Teresa,
Aye.
Lisa,
Aye.
and myself, Glenn. Aye. Very good. All right, January 6th.
Glenn, just one thing.
Yep. Yep,
Was Lisa a member of the board in December?
I got her on here.
Okay, I'm just making sure. And Swati isn't here,
Board mem-
so
Board members present. Lisa was
okay,
there.
she was there. Okay,
And
Just making
then
sure.
we've got January 6th, it says 2021, but I think it should be 2022.
hmm
How
That
about
was it.
that?
There
Aha,
you go.
okay. I read it closely. I didn't see anything further.
Sounds good.
Okay. Has anybody else got anything to change?
I would
No.
just, I would
Oh.
just say, Glenn, that I appreciate the brevity of these minutes.
Yes. I think Katie was not paying attention.
Agreed.
Oh, this was that,
I
this
wasn't
was
at
that
that
meeting.
meeting.
This was that,
The food thing.
was it the food thing?
Yeah, both the restaurants.
No, this was.
That was
on-
December.
No,
In
it was
December.
In January
That was the
was the
mask mandate.
COVID and the mask. and
Oh,
the-
yeah.
mandate meeting.
All right, then I move that we approve the January 6th, 2022 meetings, minutes as recorded, but for changing the date from 2021 to 2022. And I need someone to second that, please.
I will second the motion.
Thank you. And then we're, all those in favor, delete. Teresa,
Aye.
Lisa,
Aye.
and Glenn. Aye as well. Those minutes are approved as well. And any other business, Kristen, that we should know about?
I just wanted to mention that we did receive more detailed information in the under 5 vaccinations. And so that they're not yet approved, but the state has already opened up a pre-ordering process for, physicians' offices, local boards of health, et cetera, that would like to offer vaccination clinics. And again, the state is encouraging health departments that have the capacity to offer opportunities for our residents. So we are doing that. We're working with a medical reserve, the other communities. And I believe the library will be meeting later, but we are also considering doing the under 5 clinics possibly at the children's room at the library. It's a really interesting age group where, you don't do it at the schools because they're not in the schools yet. We want to offer a location that's convenient to parents, handicap accessible, stroller accessible at that 6 months to 4-year age category. So we are considering the Northborough Library and look for more information as we work through that process. So it's a town building with good access, and we're going to make sure that we are working with vaccinators that are very comfortable with those age categories. And so we do have great nurses with Salmon VNA that, our vaccination clinics, they've always vaccinated 18 months and up at our flu clinics. And this is something that the staff members that are comfortable and be looking to, possibly overstaff and making sure that there's more hands-on decks for those younger ages and be looking to offer. So those clinics could be held as early as late February to early March. It's probably going to be a 3-dose series, but the way the approval is going, if you're following the news, it will be the typical Pfizer 3 weeks apart, and then more information to come on that 3rd booster, the 3rd shot in that childhood series. So more information, and we do, you can inquire with the Board of Health. We do have a sign up page on the NBorough sign up, a tiny URL where we can take families' names if they'd like to learn about that. Doctors' offices are likely to offer vaccinations at the age categories, but they're limited on infrastructure and staff, and it will probably be vaccination at your routine appointments in those age categories. And there will be availability with pharmacies, like a Ready Med clinic where they have not just pharmacists. It would be probably the 6 months and up, but a true just pharmacy. If there's only a pharmacist present, they're only allowed to vaccinate, I believe, ages 3 and up. So it's a little tricky of an age category, but we will have some opportunities here and continue to partner with the other Greater Boroughs Partnership for Health Communities in offering these clinics.
Kristen, question, do you have any idea what the numbers are? I mean, we're talking about 5 and under. I mean, that's not a huge population in town.
No. I mean, I think of our other categories, right? We ordered 1,200 doses for, this school age category. And that, the good news is with this vaccine, we can order in increments of 100. And the state's been great, federal government, and sending us vaccine as quickly as we order it, within a week. So I think we'd be looking for smaller clinics, and probably, we'll see. I mean, it's really hard to gauge interest, so you don't want to over order and waste vaccine. So
Right.
we'll be doing probably 1 to 2 clinics, really see where demand is, some follow-up smaller clinics after that. But I'm anticipating ordering, I guess just for Northborough alone, 200, 300 vaccines. I think a lot of families are going to look to their doctor's office. So it's not the same as the older age categories.
Correct.
Where, I haven't been to my doctor in 3 years. I can't even get a hold of him anyway, that kind of 20 something don't have a primary care provider. It's a little different here. So we'll start small and order more if the demand is there.
Will the primary care, the primary care doctors can get it. Of course, it requires special refrigeration and special, refrigeration, storage techniques, right? And some of the smaller offices may or may not have access to that. The larger ones like the Reliance, the UMasses, the St. Vincent's, they do have that. But the smaller offices, the single doctor offices, many times don't want to invest the $3,000, $4,000 for that special refrigerator.
Yeah, luckily this is the better buffer. The old
Okay.
buffer with Pfizer was problematic. This is in the newer buffer, so it is good for 10 weeks in a regular refrigerator. But what we
Okay.
hear from our local providers is they're 10 dose vials. And they just, we were all taught, don't waste vaccine, don't waste vaccine. And so, it's hard for a small practice to hit 10 on the nose.
Right.
And so that's where another reason why a lot of the offices, they did order the 5 to 11, they ran a few clinics, but it's tough just to sort of do it through the day and to not waste a lot of vaccine. So for some
Correct.
offices, they preferred to push COVID vaccine to another location or to regional clinics or other opportunities. That's the 10 per vial. And once you pierce a vial, it's no good after, a certain period of time that
Yep.
day. So it's not like you can continue to pierce the vial or preloaded
That's-
syringes like flu.
Yep, exactly.
Yeah.
I think the library is an excellent idea, though.
Yep, center
Little
of town.
kid, probably there anyway. Not 6-month-old. You get the gist. You get the gist. Okay. Anything else? Kristen?
Nope, that's all for me.
All right. That was a good meeting. Not that they're all not good, but that was exceptional. We're gonna establish a tentative future meeting date for March 8th, 2022. Unless something changes, comes up, or we'll discuss it. With that, if we're done, we're done. I move that we close out the meeting at whatever time it is. I can't say. And,
7:09.
we'll pick it up on the other side.
Second,
All those in favor? Dilip,
Aye.
Teresa,
aye.
Lisa,
Aye.
and Glenn. Thank you all for